on the occasion of Breastfeeding Awareness Month. We have with us Dr. Hema Divakar, consultant obstetrician and gynecologist from Divakar Specialty Hospital, Bengaluru. Doctor, can you tell us why breastfeeding is so important for both mothers and babies?
The simplest way you can describe is breastfeeding is the best feeding. And as you can guess, there could be no replacement between the skin-to-skin contact, the bonding with the mother, the new mom who is the best incubator for the processed infection-free milk with the strong content of the immune bodies, which gets into her little baby to give the gift of good health for the rest of the life. There are several literature evidences that nothing can replace the content of the breast milk the way nature has negotiated it for the best benefit of the newborns.
What is the ideal duration of breastfeeding? For how many months should a baby be breastfed?
As we said, started within the first hour after birth. Exclusive breastfeeding for 6 months is the best. And ideally, for a whole year, if the mother breastfeeds, it's not only good for the baby, but also for the mother. Regain her pre-pregnancy weight. There's an element of weight loss when she is breastfeeding the baby. Also, if she has been diagnosed as high sugar or diabetes in pregnancy, then if she exclusively breastfeeds the baby for 6 months and further continues for a year, then the chance that she will become a type 2 diabetic is reduced by 57%. And isn't that a great thing to happen? And it's also cancer protective, and the moms may not really recognize, but it is for us to educate them, make them aware, and tell it's not only good for your baby. Of course, it's good for your baby. Every mother knows that, but it is also so good for themselves. And also the infection barrier is just not there. Better than the natural container, that is the breast tissue. Go for it as your first and the best choice.
How would you describe the current breastfeeding scenario in India?
When we actually take the data, we have recognized that only 40%, that means 4 out of 10 babies are breastfed in the first 1 hour after birth. That to our mind is very, very low, because that's called the golden hour. That is where the connect between the mom and the baby and the centers in the brain to let down the milk, which is called the let down reflex, gets established. So it's very, very crucial to pay attention to the golden hour, where we want a zero tolerance, and they should be exclusively breastfed for the 6 months. So this is really not happening. Breastfeeding, sometimes to my mother's mind, a new mom may not always find it easy, but believe me, it is so worthwhile for the benefits that it gives both to your baby and to yourself as well.
What are some of the major challenges that mothers face, and how can they be addressed?
The major challenges is about the mindset of the patient. Usually, because it's a new task, she may have some myths and misconceptions around it. So that is usually a challenge, and there are too many people around her advising a variety of things, which really confuses the vulnerable mind of a new mother. So that's a huge challenge. And once they get on with it, it comes very, very naturally and with ease. The staff nurses, the paramedicals, everybody who is associated with the care of a newborn mother, if each one does their bit to help the new mom successfully breastfeed the baby.
Doctor, what message would you like to give to our listeners?
It is an opportunity for every new mother to do the best for her baby and gift the good health in the journey of this baby throughout its life course. If you've done that, then more than anything else that you would do for your little one throughout their life course, this will be a very important milestone and the start point to health, set and go. That's the final message.
Thank you, Doctor, for your message.